it's really an area that's just beginning to get attention, and that cannabis is a complicated issue for all of us, especially as it becomes increasingly legal across the United States. And it kind of enjoys a health halo that I've experienced clinically among our patients living with MS, and that it's thought to be a value add or a safe and somewhat effective way to manage a host of symptoms. But unfortunately, it's very hard to study, for one thing. And in general, the evidence just isn't there to support many of the ways it's being used, especially like for sleep and anxiety and for pain. And there's just not enough evidence there. In the meantime, there's been some really great studies that have shown that when people reduce their use of cannabis, they actually feel better. They have a reduced symptom burden, particularly with cognitive health and mental health issues, like, for instance, cognitive functioning and depression and those kind of symptoms actually tend to improve. And so that's been shown specifically in people with MS. And so with that, I'm a clinician and I work with people living with MS every day. And I often ask about cannabis use, and it's a very high rate. It's estimated that up to 50% of people, or more than half of people living with MS, use cannabis in some form. And we know that in general, about 1 in 5 people who use cannabis can risk cannabis use disorder. And so we're really targeting the people who have problematic use or get into a dependent cycle where they're using cannabis and dependent on it, and they don't feel like that they can stop on their own. And so when we evaluate it, we would say, well, maybe you will feel better. You want to evaluate reducing cannabis in your life. And there's been no tool. So that's the long way of saying that there's really no tool or support right now available for people with MS or otherwise to reduce their cannabis use. So tDCS is an area of focus for us, transcranial direct current stimulation, which is a safe and well-tolerated form of non-invasive brain stimulation that we've been working with for over 10 years, primarily with people living with MS, but all different kinds of conditions as well. And it can be used in all different kinds of ways, and there's a real interest in its use in exactly this, helping people who are in a dependent cycle for drug use or for alcohol use to reduce their use in a meaningful way. And so pairing those two things together, the real problem for some people living with MS who want to reduce cannabis use, and then the just general interest of using tDCS as a tool in this way, we put that together. And so that's what our pilot study is. And so we're a telehealth program, and so we are completely contactless. Everything is home-based, which really has a lot of appeal for people to have access to the treatment right away. And so we recruited nationally for this pilot trial just to test it out, and really in partnership with our patient participants to get their feedback on it. So tDCS was delivered to people for 20 sessions. So 1 month, Monday through Friday, 20-minute sessions, the tDCS. They were randomized to active or sham tDCS. Sham is the tDCS placebo, and it was paired with mindfulness meditation, so which has a distress reduction benefit on its own. But the idea is that tDCS can boost whatever the activity is that you're doing. So we wanted tDCS to add that extra distress reduction to support that 1 month critical window of reducing use. And so when we were recruiting across the country, we met really tremendous demand. So really validating that this is a problem for a lot of people, even just the cost of cannabis habit. And so really encouraging that to continue on in this way. And so we really rapidly recruited and learned a lot about just more information about the baseline problem in general of cannabis use among people living with MS. And so we're evaluating the treatment. We haven't completely finished the study because there's a 3-month follow-up window, but all of the participants have completed the acute 1-month period intervention, and findings have been really encouraging so far. And the feedback among our patients is just really encouraging in terms of people really appreciating this intervention and using it exactly the way it would be intended, is for a structured support in order to meaningfully decrease their cannabis use and just evaluate if they actually feel better with less cannabis use. And I should point out that people living with MS are healthier in general. They're less likely to smoke cigarettes or less likely to abuse alcohol or other drugs. So it's really a specific cannabis problem among people living with MS.